and welcome to our webinar on the CMS Merit-Based Incentive Payment System, or MIPS. We're so glad you could join us today for this session with the Mid-Atlantic CMS QIN-QIO. My name is Laura Benzel, and I'm a Quality Improvement Advisor. Unfortunately, my camera's not working, but you can see my wonderful colleague, Barb, and I'll be doing the presentation, so you'll be seeing the slides. So just a little administrative stuff. So you see, you can use the chat box feature to share questions and comments. This slide has instructions, and the important thing to note is that when you go into the chat, you just want to make sure you select everyone and not all attendees. That way everyone can see your question or your comment. And I believe Barb has put in the chat that we'd love for you to share your name, your role, your organization, and the state that you're from, because we'd love to see who's joining us today. Barb will also be managing the chat and sharing some helpful resources and links during today's session. So today we're going to be talking about how participation in the CMS QIN-QIO program can support your success in MIPS. We also have some important dates that we wanted you to note for performance year 2025 as it's coming to a close. And also we're going to be talking about the MIPS value pathways, or MVPs. It's important things to note. You're going to have to transition from traditional MIPS to MVPs in a coming year. So we'll talk about that and give some tips on preparing for that. I'd like to take a moment to introduce the Mid-Atlantic CMS QIN-QIO Region 2. In case you're not familiar with the program, QIN-QIO stands for Quality Innovation Network Quality Improvement Organization. We serve providers that are caring for more than 7.5 million Medicare beneficiaries across these states and the District of Columbia. The Mid-Atlantic QIN-QIO program is built on the concept of a regional learning community where providers work together to improve patient care and outcomes. So particular to outpatient clinical practices, if you enroll in the program, you'll gain access to customized, no-cost support and a very large learning community. Over the next 5 years under this CMS program, we will be helping providers to improve care across prevention and chronic disease management, patient safety, behavioral health, and care coordination. We provide practical support and guidance to strengthen quality management and improve patient outcomes. So for this particular contract, CMS has identified select hospitals, nursing homes, and outpatient clinical practices that are eligible for participation in the QIN-QIO program. This includes those that are small, rural, or care for underserved populations, or have submitted data to CMS that indicates that there are areas that have opportunities for improvement. Providers that are eligible and participate in this program will receive no-cost customized support from our team of quality improvement experts. Our support is tailored to align with your strategic priorities and organizational needs, while also helping you to achieve CMS priorities and also drive measurable improvements in performance and patient outcomes. You'll have access to an aligned approach that focuses on key CMS measures, actionable data dashboards, tailored assistance, community connections to strengthen care transitions, and opportunities for peer learning and collaboration through our large learning community. So we have conducted outreach to outpatient clinical practices that are being invited to participate in the program. So many of you may have received calls or information. We hope you'll take advantage of this opportunity to receive this customized support. Barb is going to be putting contact information in the chat if you have questions about the program or you're ready to enroll. So let's switch to MIPS and discuss how participation in the CMS QIO program supports your success in MIPS. So as you may know, providers receive an annual score based on 4 performance categories: quality, which reports clinical quality measures, and historically the largest portion that's relevant to the practice. There's promoting interoperability, which focuses on use of certified EHR technology, electronic health records. Improvement activities, practices earn credit for implementing evidence-based, practice-level quality improvement initiatives. And last is cost, calculated from Medicare claims, and that is calculated by CMS. So participation in the QIN-QIO program can strengthen your MIPS performance, and here's how. So in the improvement activities category, active participation in the QIN-QIO initiatives qualifies toward MIPS IA credit, giving providers measurable recognition for quality improvement work that is already underway. Under the quality category, our team supports providers in tracking and improving outcomes on measures such as hypertension control, diabetes management, infection prevention, falls reduction, and safe care transitions, many of which are directly tied to MIPS reporting requirements. Within promoting interoperability, we work with practices to optimize the use of certified EHR technology, patient engagement tools, and secure data exchange, all of which contribute to higher PI scores. And finally, our emphasis on reducing avoidable hospital admissions, emergency department use, and adverse drug events directly supports improvement in the cost category. So we're going to share some important dates around MIPS and some important activities that we want you to note. These are not all inclusive, but these are just dates that are important for as we approach the end of the performance year. Remember that CMS determines annually who must participate in MIPS. So forgetting or missing a deadline can result in penalties and lost incentives. CMS has updated eligibility status based on their review of data for October 1st, 2024 to September 30th, 2025. So knowing your status is important. You can review your final eligibility status for MIPS in the Quality Payment Program Participation Status tool using your NPI number. So Barb is putting a link to the Participation Status tool in the chat now for your information. Your status may have changed during the determination period, so again, we encourage you to check it. The status tool will show you if you qualify to report individually, as a group, or both. So this means you may need to report MIPS for more than one practice. The CMS tool lists any practices your NPI is associated with, and if you have a special status designation such as hospital-based, non-patient facing, or small practice. The status tool also includes information about your ability to opt into MIPS. So what does that mean to opt in? This means if you or your group is eligible for MIPS and exceeds one or two, but not all three of the low volume threshold criteria, you're considered opt-in eligible. So this means you can, number one, take no action because you have no obligation to participate in MIPS. Number two, you can opt in for traditional MIPS or APM performance pathways only. If you decide to opt in, you report data, you receive performance feedback, and potentially earn or avoid negative Medicare payment adjustments. The last opt-in option is if you don't want to receive a MIPS payment adjustment in 2027, but you want to participate in MIPS, you can voluntarily report data and receive limited performance feedback on the data that you report. Another thing to note, CMS has updated results for the rural special status. This designation gives clinicians in designated rural areas reduced reporting requirements and bonus points. So you can check if you're eligible for this special status, again, using the participation status tool. Please note when checking your eligibility status that you will need to review your eligibility for each TIN or practice for which you submit Medicare claims. It's important to check both your MIPS and your APM participation status. So if you'd like to learn more on how MIPS eligibility is determined, you can check out the 2025 MIPS Eligibility and Participation User Guide Barb is putting a link to this guide in the chat. We also wanted to let you know that the deadline for the MIPS hardship exception is approaching. So the MIPS hardship exception allows providers and groups to request that one or more of the 4 MIPS performance categories be reweighted to 0% if they face uncontrollable circumstances that prevent data collection or submission. Some examples are natural disasters, practice closures, severe financial distress, or issues with EHR technology. So Barb is placing a link to more information on these exceptions in the chat if you want to explore if you qualify for one or both of these hardship exceptions. An important date to note, the hardship exception application deadline is 8 p.m. on December 31st, 2025. You'll need to submit the application with a HARP account. If you need information on how to obtain a HARP account, refer to the QPP Access User Guide. Barb is putting a link to the user guide in the chat. So let's talk about the MIPS value pathways, or MVPs. So currently there are 3 MIPS reporting options available to MIPS eligible clinicians to meet the MIPS reporting requirements. There is traditional MIPS, which is the original reporting option. There is alternative payment model performance pathways, which is a streamlined reporting option for clinicians who participate in a MIPS alternative payment model. And then we have MIPS value pathways, or MVPs, which are the newest reporting option that offers clinicians a subset of measures and activities that are relevant to a specialty or to a particular medical condition. The reason MVPs were developed is that they offer more meaningful groupings of measures and activities, and that will provide a more connected assessment of the quality of care. So each MVP includes a subset of measures and related activities that correspond with a specialty or a medical condition. So MVP reporting will measure the performance of specialists within a practice, such as rheumatologist or neurologist. The MVP framework uses specialty-focused pathways, of which there are currently 21. Each pathway that your practice reports on will have its own subgroup of clinicians. It'll have its own measures and its own submission. So for performance year 2026, CMS has proposed 6 new MVPs, and they've also made modifications to the current 21 MVPs. So a few points to keep in mind is, as an MVP participant, you'll select, collect, and report on a reduced number of quality measures and improvement activities as compared to traditional MIPS. You'll also report the complete promoting interoperability measure set, the same as reported in traditional MIPS. And an important thing to note, MVPs will eventually replace traditional MIPS. So we'll have more on that on the next slide. Barb is going to put a link to information on MVPs in the chat. If you're new to these, this will take you to the CMS information to learn more about MVPs. So currently, MVPs are optional. Voluntary reporting began in 2023. You can still meet MIPS reporting requirements through traditional MIPS and MIPS APM. Please note that if your practice is voluntarily reporting MVPs, if you're already engaged in doing MVPs, starting in performance year 2026, any multi-specialty groups are required to report as subgroups or individuals, not as a single large group. So what does that mean? Well, a subgroup comprises a subset of clinicians within the same tax identification number, or TIN. Under traditional MIPS, reporting options require all clinicians under a TIN to report the same measures and activities. So as I mentioned on the last slide, this can make it particularly challenging for clinicians in multi-specialty practices to report measures that are really meaningful to them, and MVPs aim to change that. Subgroup reporting under MVPs provides an alternative by allowing practices to form subgroups of clinicians who can report the MVP that is most relevant to their specialty or the conditions that they manage. The group can also report individually for one MVP. There is an exception for small multi-specialty practices of 15 or less clinicians. Those practices can still report as a group. So as I mentioned, and this, I apologize. As I mentioned, this is really important. CMS intends to sunset traditional MIPS and will require MVP reporting. So you might be asking, when is that going to occur? Well, let's look at the next slide that sort of answers that question. So this timeline is from the CMS QPP website. And as you see noted on the far right with some orange arrows, the end of traditional MIPS and the rollout of mandatory MVP reporting are shown in a future year. So currently CMS is being vague about the date of this transition. However, we encourage your practice to consider transitioning to MVP sooner rather than later. They're definitely coming, and it may require some work for your practice to transition. So CMS has floated 2029 as the year that this transition will happen. So we encourage you to consider using the next 3 years to test run one or more MVPs. So the MVP application process for performance year 2026 has already closed. It was December 1st. So if you miss this application period and are considering submitting an application to do MVPs in 2027, you can do that starting April 1st of 2026 through December 1st. And that'll take effect at the following performance year. So while the program is still voluntary, again, we suggest doing a test run of 2 to 3 MVP pathways. You might want to consider starting with the value in primary care MVP because this is the one that is most similar to traditional MIPS. And as you get comfortable with that, you might want to add 1 or 2 other pathways if they're applicable that are more of a challenge for your practice so you can expand the learning process about MVPs, submitting the data before they become mandatory. So whether you have submitted an application and you will be forging ahead with MVPs in 2026, or you're thinking of submitting an application for 2027, we are here to provide support to you. CMS is promoting MVPs as an easier, more streamlined version of traditional MIPS. However, there are a few caveats, so let me explore those a bit with you. So this table provides a high-level comparison of traditional MIPS versus MVPs to help illustrate the reporting changes. So under traditional MIPS, a practice reports under one TIN. For MVPs, a practice may be divided into subgroups based on specialty, also under one TIN. For traditional MIPS, there is one group submission based on the TIN. For MVPs, there is one submission per subgroup, and there are applicable MVP measures within the TIN. So depending on the number of subgroups, the reporting requirements can be a bit more complex for MVPs. For traditional MIPS, you submit the 6 best performing measures from the set of quality measures. For MVPs, you submit the 4 best performing quality measures for each MVP and subgroup submission. So that's that reduction in the measure requirements. For traditional MIPS, there are 4 performance categories. Under MVPs, 1 category has been added, population health, for a total of 5 performance categories. And lastly, for traditional MIPS, there is a single group reporting for the improvement activities and the cost categories. Under MVPs, there's MVP subgroup specific reporting for these 2 categories. So the MVP workload and reporting process is different and it may be more complex. So let's take a look at an example using a fictitious practice. Under traditional MIPS, a 50 clinician practice with 3 subspecialties is monitoring and will report on 10 electronic clinical quality measures, or ECQMs. For MVPs, that same practice will have 3 submissions of 4 measures each. So for example, they may have a subgroup of clinicians that are focusing on the optimal care for kidney health MVP. They may have another subgroup when they'll be submitting data for the advancing care for heart disease MVP. And they may have a third submission for the value in primary care MVP. And again, there will be 4 required measures for each of those MVPs. So as you can see, the monitoring reporting workload can be a bit more complex. So again, keep in mind that although CMS hasn't announced the date for the sunsetting of traditional MIPS, let's assume they decide 2029. That actually has been the year that they have proposed. So again, consider starting the transition now. And here are some examples of how that might look. So the first option is to register as a single clinician to report an MVP as an individual, with the option to report an MVP as a part of a group or subgroup. And you can see here, there's some examples listed. By the way, we'll be sharing these slides, so I'm not going to go into all the detail, but you can review this information when we send out the slides. The next option is to register as a group. This provides the opportunity to register one MVP for a group on behalf of all clinicians in a practice. The practice can register as a group in addition to registering individual clinicians or a subset of clinicians as a subgroup to report a different MVP. Registration as a subgroup, which is the next option, means registering some but not all clinicians in a practice to report under one MVP. This is recommended for multi-specialty practices to allow reporting of more than one MVP based on clinical relevance. And the last option is participation by registering as an APM entity to report an MVP. So again, these important dates that we want you to note, again, the hardship exception deadline is December 31st of this year by 8 p.m. The MIPS performance year 2025 data submission period is January 2nd, 2026 through March 31st, 2026 by 8 p.m. And if you're considering entering or registering for the MIPS value pathways for performance year 2027, you would do that from April 1st, 2026 through December 1st, 2026. This is a list of resources that you may find helpful. Barb put many of these in the chat, but we've also put them here on the slide for your information. And I did share a lot of information and I went through it very quickly today. So we understand you may have more questions or need clarifications. Please feel free to reach out to us. These are our regional contacts. These team members are here to listen, collaborate, and ensure that we bring you the most meaningful support to your state and to your practice. So please don't hesitate to reach out to them as we move forward. So I'm going to pause and see, Barb, are there any questions or comments in the chat?
Thank you, Laura. Great presentation. No comments in the chat yet, but we'll give people an opportunity to think about their questions and let us know what your questions are.
While we're waiting for that, let me show this slide. Again, we encourage you and hope you'll take advantage of participation in the QIN-QIO program so that you can gain access to no-cost tailored support. Here's an email account. This is a general email account that you can reach us at, as well as contacting the regional specialists that I showed on that previous slide. And if you want to learn more about our QIN-QIO, this is a link to our website here as well. So if there are no questions or comments, I'm going to conclude our time today. Just confirming, Barb, nothing new in the chat in that short time.
No, nothing new in the chat. And I want to encourage everyone who is one of our outpatient clinical providers to please put your contact information in the chat so we'll know how to reach out to you and make sure you are informed of future webinars and information about not only the QIN-QIO, but also about the MIPS program. So I see a couple from West Virginia who have shared their information with us. Thank you so much. And please share with us who you are. So we want to stay in touch and make sure we have an opportunity to collaborate with you.
Wonderful. Thanks, Barb. Well, I just wanted to say, since it's, what is today, the 17th, we're in the countdown to Christmas. If you celebrate, have a wonderful holiday and a happy new year. Hopefully we'll be working with all of you in the new year and providing support to you. I see some information still coming through the chat, so we're not going to end the webinar yet. You have a few days left to do some Christmas shopping if you need to do that.
And happy Hanukkah.
Yes.
Mm-hmm.
Thank you all for joining us. And again, have a wonderful holiday. Take care.